Welcome, everybody. My name is Peter Perry. I'm with the Pender Islands Healthcare Society Board, and welcome to this is Here's to Your Good Health series. We have a special guest today, Dr. Estello Nap Hill. I just got to know Dr. Hill in the last day, and you're in for a treat. So Estello did his undergraduate degree at McGill. He actually got a football scholarship to McGill to join the McGill Redmen. And his mother has had a big influence on his life because Estello went to McGill for his undergraduate degree. He got a football scholarship. And he had a conversation with his mother, who had a big influence on his life, while he was there. And she said, "What courses are you taking?" And he told us these sort of Mickey Mouse courses that football players take, and he says, "I don't know about that." So he changed his mind and decided to concentrate on his studies, dropped out of football and joined rugby, and decided he was going to get into medical school. And he heard that UBC ignored your first year marks, which was good, and he applied himself, and he got through undergrad degree, got into medical school. His mother also suggested that a good summer job would be to come and work in the GI clinic, where she is the nurse in charge of the GI clinic. And so he came during his summers during undergraduate and worked in the GI clinic, and eventually ended up to be a specialist in GI, the gastrointestinal tract. So his mother, like all mothers, right, has had a big influence on him. So he's passionate about the gut, aging guts, and I see there's lots of aging guts. So this is his fertile ground, so to speak, and he's passionate about the microbiome. So you're in for a treat. We've had him for 24 hours, and we've talked about lots of things around the gut. So welcome, Estello.
Can you guys hear me okay? Yeah. Can you hear me without the microphone?
Yeah.
Okay.
Big voice.
So I'll leave it down, and if you guys need me to speak up, I can speak up at any point. So first off, thank you so much for having me here. Peter and Lisa, it's been such a treat to explore and to experience Pender Island. My fiancée Janelle and I have fallen in love with this place, and it's been really special. Today we're going to be talking about the aging gut. We're going to talk about the microbiome. We're going to talk about some common digestive conditions and what can you do as you age, and just things to know about making healthy decisions for your gut. It's not meant to be overly scientific or overly complex. It's meant to be an overview, and hopefully at the end of our talk today, you have a little bit more of an understanding for what's going on in your gut, what decisions to make, what foods to maybe eat, and what might be happening if things go wrong or go right as we go. So without further ado, we'll get to things.
Try aiming at that.
Okay, all right. Your oldest friend, so we're talking about the gut microbiome here. When we're born, when we're in our mother's womb, there's no bacteria within our gut. It's a sterile condition. There are some studies that suggest maybe there's a little bit of colonization, but it is trivial at best. The moment that we come out of the birth canal, we're exploded into a vast sea of bacteria, the vaginal canal, the nether regions down there, everything is kind of exposed to the baby coming out, and immediately the bacteria begin to colonize our gut. The bacteria in the beginning will start to help us to digest mother's milk and things like that. And as we age, it actually continues on and develops and serves special roles. So tonight, we'll get to meet the gut microbiome and all of its crazy wonders. 500 million nerve cells. The gut is known as the second brain when it comes to the nervous system in the humans. One thing that is a fact that I really enjoy is that if you were to disconnect your gut's nervous system from your brain's nervous system, and you were to look at the level of complexity and nuance that is existing just within the gut, it's about as smart as a large dog. So if you think about that for a second, if you were to completely disconnect your brain from your gut and you were to have them running in parallel, your gut itself is as complex and has enough nuanced and nerve connections as a large dog. And the way that forms itself in your gut is it worries about digestion, it worries about hunger. You eat something and it says, okay, it's time to start moving peristalsis, time to secrete enzymes, time to do all of these things. And it's this complex interplay of signals and things that accomplishes digestion. Now, because it's as complex as a dog by itself doesn't mean that it does always work in isolation. There's a lot of interplay between our brains and our guts. 70% of your immune system exists there, and 90% of the body's serotonin is also made in the gut. But one important thing to clarify here is that this serotonin that's made in the gut serves a particular purpose in the gut, and then that's with digestion. It doesn't necessarily cross the blood-brain barrier or work in the ways that we think of selective serotonin reuptake inhibitors or with anxiety and depression and things like that. It's a little bit different, but something to keep in mind. What is the gut microbiome? So in numbers, when we think of the gut microbiome, we think of around 38 trillion bacteria that are living inside you right now. We specifically think about the gut microbiome because it's got the highest density of bacteria, but we have a skin microbiome, we have a oral microbiome, gut microbiome, lung microbiome. There's a microbiome that exists a little bit everywhere, but the gut microbiome is by far the most robust and colorful. There are over 500 different species of bacteria that exist in a healthy gut, and you'll understand by the end of this talk why a diversity of species is going to be important. And something that I find is always very interesting to think about is that there's 100 times more DNA if you were to break down all of the bacteria in the gut compared to the genetic code that we carry as humans. In numbers, and to give you a little bit of a visual, if you were to weigh all of the bacteria in your gut microbiome, it weighs about as much as a bar of soap, yet their influence on your body is immeasurable and quite significant. So what does it do for you? Your gut microbiome has a lot of clearly defined functions. It turns fiber into fuel, so your dietary fibers, mainly the things that your body cannot digest, insoluble fibers, and fermentable fibers, it can turn them into fuels that have healthy effects for your gut and healthy effects for your body as a whole. It makes vitamins. Vitamins like vitamin K, vitamin B12 are essential vitamins that the body needs that cannot be produced without our gut microbiome. It guards against infection, so it has an important role in both teaching the immune system and augmenting the immune system to allow it to defend against pathogens. It sends signals to your brain along the gut-brain axis, which can influence your mood, your cognition, and it balances your immune system, kind of making sure that it's not too overreactive or too underreactive. Now, I alluded to this a little bit in the beginning, that your microbiome changes across a lifetime. At birth, it's rapidly colonized at the time of coming out. And we do see that there's a little bit of a difference between babies that are born vaginally and babies that are born by C-section in their immediate colonization of the gut. The function of the gut microbiome at this stage is primarily to help babies digest milk. And so we see that when you look at a baby's gut microbiome in these years, it's quite specialized for that. As soon as the baby starts to eat solid foods, we see changes in the gut microbiome that start to represent a more diverse array of function, helping to digest fibers, helping to digest foods. And so the types of foods that babies start eating will then drastically change the gut microbiome. At that point, around introduction of solid foods, you develop the blueprint or the stable kind of infrastructure for what the gut microbiome will look like for the rest of the adult life, but it can change. So in your adult life, it's relatively stable following this outline. However, things like diet, things like exercise, medications, antibiotics, sickness, health will all kind of give the microbiome a push in a certain direction to get more or less diverse, more or less abundant. And then, particularly for today's talk about the aging gut microbiome, we do see that after the age of 65, there are specific age-associated changes. The age-associated changes are usually described as a decrease in diversity and an increase in abundance of some of these, what we call pathobionts, or the bacteria that can cause disease. Whether it is us getting older and becoming a little bit kind of having accumulation of diseases, causing a change in the microbiome, or it's the microbiome changing and that causing accumulation in diseases, is hard to prove in science, but it seems to be a combination of both. And one thing that we know is that in populations of people who are centenarians, living over the age of 100, they often are populations that are also maintaining a robust, diverse microbiome, which is reflective of diet, lifestyle, and overall health status. So what are some of the things that contribute to the change in gut microbiome as we age? One of the things is slower transit. So as we get older, our ability to move food from the esophagus pipe down to the bottom end just slows down. And it's not anything that you can necessarily do, it's just a function of aging. The machinery gets a little bit slower, the muscles get a little bit thinner, and over time it just slows down a little bit. But that's one of the things that can contribute. The gut wall can become more porous, or you can develop somewhat of a leaky gut. And so when I say leaky gut, you can imagine that each cell in the bowel forms a barrier. And over time, if the barriers increase or the cells don't maintain as tight of a junction, all of the food, all of the bacteria, all of the things that are going through our digestive system get more exposure to our bloodstream and get more exposure to our immune and our systemic systems, which can have an effect. You get a weakened immune defense system, and so that 70% of your immune system that exists in your gut starts to decrease a little bit over time. And then you get declining of the beneficial bacteria. So all of the robustness that was built over time can start to decrease. And again, I want to emphasize that this is not something that will 100% happen. Whether this is correlative or causative is not really well studied in the literature, but we do know that most of this is driven by lifestyle. So what we see when we do studies like this is that as people get older, their lifestyle changes. As people get older, a lot of the healthy habits that they've built up tend to decrease. And so for the people who maintain a healthy lifestyle, that has a considerable effect on maintaining a healthy gut microbiome. So back to the leaky gut. This is just kind of giving you guys a visual of what I was describing there. If you imagine that the gut wall is like this brick wall here, as we get less abundant energy sources, less abundant health of the bowel, we start for these gaps to open. So you could think of the gaps between the brick walls as opening. Your immune system then is exposed to much more than it usually is, so it becomes a little bit more active. And as the immune system in the gut is becoming a little bit more active, this can lead to a little bit more inflammation. And not necessarily inflammation on the scale of your whole body going into an autoimmune state or having a huge immune attack, but low-grade inflammation. And low-grade inflammation over long periods of time can contribute to some of the negative changes. So this kind of gets to this idea of inflammaging. Now, I didn't coin this term myself, but it's a useful way to think about the long-term effects of these subtle changes that are happening. It's not anything that's happening big and all at once, but it's something that's slowly burning, and that little decisions on a daily basis can either push you towards more inflammation or less inflammation, and the culmination of inflammation is going to then contribute to the overall health and wellness of any individual. So what are some of the things that inflammation can be associated with? Heart disease, diabetes, memory loss, muscle loss, and some of the things that we can do to prevent it would include some lifestyle tips that I'll give you later on in this talk. So we'll just take a quick moment to talk about one of the most important byproducts of the gut microbiome. So the gut microbiome is going to take fiber. It's going to help you digest the fiber that you can't digest, and it's going to turn it into beneficial byproducts that have a positive effect on your body. There's three ones that we usually talk about, and they're called short-chain fatty acids. They're butyrate, propionate, and acetate. Butyrate's probably the most important one, and we'll take a chance to talk about that today so you can kind of understand what's actually going on, because it pertains to these leaky guts, and it pertains to the health of the epithelium, or the inner lining of the bowel. So what butyrate is, put simply, is it's an energy source for your colonocytes, which is just the name of the cells in the colon. When you don't have enough butyrate, the colon cells cannot get enough energy, and because they can't get enough energy, they can die, they can have the gap junctions open, leaky gut, all of these things. If we get enough fiber and the gut microbiome is able to create enough butyrate, then we can move it in the other direction and maintain a healthy gut lining. So some of the positive benefits that butyrate has shown: it powers the colon cells, like I mentioned. It's the primary energy source. It seals the gut wall, making sure that brick wall is full of good sealant. It calms inflammation, because now that the gut wall is fully sealed, the immune system is seeing less bacteria and less things that it shouldn't be seeing. And it also may have some cancer protection risks, as we know in some situations. We'll talk about colon cancer near the end of the talk, but that fiber intake has a positive protective effect on the development of colon cancer. So just before we go on to those other things, your gut microbiome has a big role in your metabolism as well. I mentioned butyrate. I won't get into the specifics of the other short-chain fatty acids, but what I want you to take away from our talk is that it's almost like these things that the gut microbiome are producing are metabolically active. They have impacts on blood sugar. They can help to regulate the way that your liver creates energy, the way that your body responds to glucose, and then through those mechanisms, they can increase your insulin control, your insulin responses. So that's proven with patients with diabetes, type 2 diabetes. Increased fiber intake can reduce the need for insulin. And also, one study that I really enjoyed was that they looked at giving people different types of breakfast and then monitoring the level of blood sugar throughout the day. One group of patients got lentils for breakfast, and I'm looking at Lisa because she made a lovely lentil soup for us, which we had this afternoon. And then the other patient group had bread and toast and eggs and something along the lines of that. And what they found was that having a large bowl of lentil soup in the morning, and importantly a high dose of fiber in the morning, actually caused a decrease in the blood sugar spikes. And that decrease in blood sugar spikes was sustained throughout the entire day. So it wasn't just the one meal that was beneficial, it was that first meal, and then it didn't matter what they had for lunch, their response was also blunted, and dinner as well, the response was also blunted. So this is an effect that you get the benefits from not just at the time of eating it, but you get the benefits that kind of last throughout the day. So that also ties into blood sugar control. And then I'm going to talk a little bit about red meat, because in the same way that the gut microbiome can ingest fiber and create healthy byproducts, it can also ingest other things, and particularly with some red meats, it can create unhealthy byproducts that can be shown to cause things like colon cancer. So what is this red meat connection? Essentially, it comes down to this one molecule called TMAO. And so when you eat red meat, your gut bacteria break it down, and the byproducts from that are converted to TMAO in the liver. And some data has shown that this TMAO circulating in the bloodstream can cause low-grade inflammation, which causes damage to blood vessels, which can also cause an increased risk of clotting, and in some cases, increased risk of things like high blood pressure and heart disease. This is not to say that nobody is allowed to eat red meat. It's just an example of the everyday choices that we make are cumulative, and if we can make more certain choices, it can make an additive effect on the overall health. Now, I promised you we would talk a little bit about centenarians, and so here we are. When they looked at these blue zones, or these areas that had people living well over 100, and they've done microbiome studies, they looked to see what was distinct or what was particularly special about their microbiomes. Was there anything that could be gleaned in certain cultures, and was there anything that really made them stand out? And so the first thing is that centenarians maintained the high diversity and the abundant bacterial spread in their guts that was not what they saw in certain aging populations. So they didn't have that aging gut microbiome the same in some of the other studies. Number two was that across different countries, they found the same patterns. So it didn't matter if they were looking at a group of people in the Mediterranean or if they were looking at a group of people in Japan, the patterns that they saw in their microbiome changes were similar. And then thirdly, it's kind of coming back to the same point that the more diversity that was maintained, the more longevity was associated with some of these communities. So this kind of concludes our part of the talk about the gut microbiome. If you guys have particular questions about the gut microbiome, we can talk about that at the end probably, and then we'll be moving into more so just common digestive conditions as we age, what to expect, a little bit of education about it, and going from there. We'll be talking about acid reflux, diverticular disease, colorectal cancer, C. diff, constipation, and bacterial overgrowth in some places. So the first thing is heartburn and acid reflux. As a gastroenterologist, this is something you see on a daily basis, and this is something that affects a large proportion of the population. One important thing to know about this is that a lot of the treatment for heartburn can be lifestyle mediated. And so before reaching for a lot of the medications and stuff, there's a lot of things that you can do to try and make a difference. And so some of the lifestyle habits that help most people are small, frequent meals throughout the day. So reducing the volume of food and reducing the volume of stuff in the stomach. Heartburn usually comes up when we have our lower esophageal sphincter right here. It functions as a protector of the gastric acid and the esophagus. And as we age, it just naturally gets a little bit more relaxed. And as it relaxes, it causes reflux, and that reflux is what most people experience as heartburn. Timing matters. So when we lay down immediately after eating, that lower esophageal sphincter can open up and that acid contents can reflux back. And then lastly, there are certain trigger foods that, independent of how much or what you're having, will cause that lower esophageal sphincter to relax as well. Some of these things include alcohol, caffeine, and fatty foods. So these are just easy things. Smoking cessation is another thing in there that makes a huge impact on reflux and GERD. Now, if you've tried all of these things and you come in to see the gastroenterologist or your family practitioner and you say, I need something for my acid reflux, they'll probably give you a acid blocking medication. So they are useful in the short term, and they are by and large very safe. And so it does have some evidence that it may weaken bones and reduce B12 absorption and disrupt gut bacteria balance. And so if you don't need the acid blocker, you don't need to be on it. If you're on the acid blocker and it's helping you, the benefits of it helping you are probably greater than the benefits of stopping it and having to deal with really bad reflux. Diverticular disease is another really common thing that happens as we age. And so what diverticular disease is, if you can imagine, is that the colon is a long, smooth, for the most part, tube. And as we age over time, it develops these outpouchings. And the outpouchings then can be associated with worsening bowel habits. Sometimes they can get infected and cause diverticulitis. Sometimes they can bleed and they can cause a diverticular bleed. Interestingly, again, over dinner with Peter and Lisa, we were talking about a very interesting observation that was made in West Africa. I believe it was Dr. Burkitt, the physician who discovered Burkitt's lymphoma. He noticed that the one interesting thing about the West African people is that they didn't have any evidence of diverticular disease. And the other thing he noticed was that their stools were huge. And so he tried to put 1 and 2 together, and what it ultimately came down to was that they were eating a tremendous amount of fiber. And so this kind of ties in that in Western society, we've ultra-processed so many of our foods, and we've really gone away from the natural amounts of fiber that the human body is meant to eat. And some of the diseases that we develop can be a manifestation of that, diverticular disease being one of them. Now, if you have diverticular disease, it's not something that is life-threatening or anything like that, but it's another reminder that the importance of fiber has with keeping our guts and our colons healthy. Colorectal cancer. Colorectal cancer is the number 2 cause of death for Canadians, and scarily, it is increasing in prevalence in young people particularly. It affects around 25,000 Canadians every year. Each decade after the age of 50, your risk for colorectal cancer doubles. And so I'm sure many of you have been screened for colorectal cancer, may have had a colonoscopy or 2 in your lifetime. And so the purpose of screening for colorectal cancer and colonoscopies is to catch the lesions that turn into cancer early and to take them out. Also to catch any other sort of digestive or colonic diseases. That's the main thing. So screening is the one most powerful thing that we can do, not only to diagnose, but also to prevent colon cancer. FIT tests are non-invasive measures of screening for colon cancer that we use. As opposed to getting your colonoscopy done, the FIT test will screen for microscopic amounts of blood. And that microscopic blood that it detects is an indicator that you may have a polyp or you may have something that warrants invasive tests like a colonoscopy. So whether you're getting a colonoscopy or getting a FIT test, all roads do eventually lead to getting a colonoscopy if positive, and that will allow the gastroenterologist to diagnose, treat, and remove any precancerous lesions if so. The one shortcoming of a FIT test is that it's only about 90% accurate. It can detect a lot of things early, but if there's any risk for things like family history of colon cancer or abnormal symptoms like bleeding, weight loss, things for concern, usually it's safest to just go straight to a colonoscopy. We usually screen with a FIT test every 2 years based on the Canadian guidelines, and we screen from the ages of 50 to 74. And I'll just add that that age cutoff of 74 is because on a global population scale, 74 is kind of like, it's up for grabs whether or not people remain healthy enough after 74 to continue to undergo colonoscopies and whatnot. If you are a healthy 75-year-old, a healthy 80-year-old, a healthy 90-year-old, by all intents and purposes, it's reasonable to continue to be screened for colon cancer because colon cancer is one of the cancers that is entirely preventable. If the colonoscopy preparation and the procedure become too risky with other medical comorbidities, or if somebody is too frail to undergo that, that age cutoff of 74 then comes into play. So, what are some tips to lower your colorectal cancer risk? Thinking back to our West African friends, eating more fiber, targeting 25 to 30 grams daily from vegetables, legumes, whole grains, fruits, soluble fiber, insoluble fiber, fermentable fibers, non-fermentable fibers. These will make your gut microbiome happy and they'll reduce your risk of developing colorectal cancer. 25 to 30 grams is the minimum. When we look at our counterparts in West Africa, they're eating upwards of 100 grams of fiber per day. So it's not that once you hit this mark, you're golden. This is the minimum we should be getting. And it kind of starts from there. We'll talk a little bit more about fiber later, but the way I think about fiber is like lifting weights for your gut. You're not going to go to the gym and put on 1,000 pounds on the squat rack on your first day and try and lift everything that you can. You're going to go, you're going to start, you're going to put a little bit, you're going to go home, you're going to recover, you're going to go back, you're going to put a little bit more, and you're going to slowly increase the amount that you're able to do. And you should think about fiber in the same way. Fiber is something you're going to slowly increase into your diet. And a lot of people don't tolerate fiber. But them not tolerating fiber is not because they are immune to it or reacting to it. It's merely a manifestation of their guts and their gut microbiome adapting to the new energy sources and food sources and getting used to that. And so over time, you can reliably increase the amount of fibers you're eating. Limiting processed meats is the second thing you can do to reduce your risk of colon cancer. I was thrilled to see that recently the World Health Organization has included processed meats as group 1 carcinogens. The data for processed meats causing cancer has existed for many years, but has not really been promoted in the way that I think it should. What does it mean to be a group 1 carcinogen? It means it's on the same scale as smoking. Yes, let me say that again. Cold cuts and processed meats are as bad for causing cancer as smoking. Just because they're in the grocery store or easily bought does not mean that they are less bad for you. Let me say that a third time. No, I think you guys got the drift, but this is something that I really want to impart, that a lot of these things are right in front of us on a daily basis, and we don't necessarily think about the health impacts that they might have, and these effects are cumulative. The other things are more general, maintaining a healthy weight. Obesity is a significant independent risk factor for colorectal cancer. Regular exercise, we usually say 150 minutes per week of moderate activity, which means non-conversational pace and actually kind of working and being a little out of breath. Limiting alcohol. The most recent guidelines do suggest that no amount of alcohol is the safest amount of alcohol, but interpret that with whatever you will. And then get fit tested in screening. That's pretty much it for colon cancer. I figured I would also take a moment to talk about colitis, inflammation of the colon. There's a lot of people who have questions about different types of colitis, who may have inflammatory colitis, microscopic colitis, infectious colitis, you name it. And so I'm just going to briefly touch on that right now. By and far, the most common form of colitis is infectious colitis. We can catch infection of our bowels just like we can catch a cold. I'm sure many of you have experienced a bout of gastroenteritis, nausea, vomiting, diarrhea that comes on, and then in a few weeks you're back to normal. The thing to know about this is this is the natural history of infectious colitis. It gets better on its own, and oftentimes there's nothing to do. And in fact, giving antibiotics or doing more things like that will cause your gut more harm than good. When do we start worrying about colitis and about diarrhea? We start worrying when there's bloody stool lasting for more than a couple of days. When the diarrhea lasts for more than 2 weeks, it becomes chronic and not acute diarrhea. When the diarrhea occurs after antibiotics, and when you have sudden symptoms and it's associated with somebody who might have heart disease or prior history of stroke, we then start to worry about other things. Inflammatory colitis, this is along the spectrum of your immune system causing damage to your colon. This has several different subtypes. It has ulcerative colitis, which causes inflammation in the colon. It has Crohn's colitis, which causes inflammation in the colon, but also of the rest of the GI tract. And it has microscopic colitis, which you don't necessarily see when you're looking at it with an endoscopy, but if you take a biopsy, you'll see that there's lymphocytic or inflammatory cells in there causing symptoms. And then the last type of colitis is ischemic colitis. This is the one we worry about when patients have cardiovascular risk factors, when patients maybe also have kidney disease, heart disease. This is more like a stroke of the colon. You have a sudden blockage or a sudden decrease in the blood flow, and that decrease in blood flow causes damage, and that damage then reacts with inflammation and symptoms. C. diff. C. diff is a particular type of infectious colitis that we worry about. C. difficile is probably the best example of how the microbiome works and how the microbiome changes when we do things to it. How C. diff infects your bowel is that you take antibiotics. The antibiotics treat your infection, and they treat your infection by dropping a nuclear warhead on all of the bacteria in your body. It has no discretion over the good bacteria, the bad bacteria, or anything like that. Its main mission is to defeat the enemy at all costs. And this is needed for life-threatening infections, for many things that people need antibiotics. But what happens in the gut, which is a secondary bystander, is when the gut microbiome gets wiped out, C. diff pops its head up and it says, oh, looks like everybody else has moved out, it's time for me to move in, and it takes over. And because C. diff is one of these pathobionts that I mentioned earlier, it is more robust, it is harder to kill, and it has resistance. So in the absence of the rest of the bacteria, it can proliferate because now there's no other residence. And as it proliferates, it causes inflammation and infection of the bowel. So we treat this again with another antibiotic, a different antibiotic targeted for C. diff. But this is why we get concerned when patients develop ongoing diarrhea after taking antibiotics. So to this point, it's important to limit our antibiotics. If you do know somebody has C. diff, or you're visiting somebody in the hospital who might have C. diff, you cannot wash it off your hands with hand sanitizer. This thing about it being resistant is very real. The only way to wash C. diff off is with soap and water and hot water. In the hospitals, we have big signs whenever this is up because you have to change your hygiene practices. Hand sanitizer is not good enough. And then it's another point to this acid-blocking medicines. The PPIs can sometimes increase your risk of C. diff by changing the chemistry of your bowels. And so if somebody's on an acid blocker and they develop diarrhea that's not getting better, that's another thing that we have to be vigilant for. A quick note on fecal microbial transplant. This is what it sounds like. It's a fecal transplant from a person with a supposedly healthy gut microbiome into a person with a supposedly unhealthy microbiome. There is a tremendous amount of controversy when it comes to what is a fecal transplant, who should get a fecal transplant, what does a fecal transplant do? The evidence for fecal transplant is very good for C. diff infections because a C. diff infection, as you could have imagined from the last bit, it's an overpopulation of this bad bacteria. So by repopulating the gut with healthy bacteria and a diverse set of bacteria, it doesn't have a chance to take over. So in patients who have refractory C. diff, who have failed oral antibiotics, IV antibiotics, or who may have very serious side effects from the C. diff, a fecal transplant is an option to cure them. They do have a fecal transplant that is kind of standardized, that is pharmaceutical grade that they use for this purpose, and it does work quite well. Now, to what extent do fecal microbial transplants have utility in other diseases or in healthy patients? That data is not there. I'm not recommending we experiment with fecal transplants. You'd be surprised. There's a lot of things that are being done, and the purpose of me pointing this up here is fecal transplant is a microbiome-based therapy, but the nuances of how it's done safely, who should be doing it, is quite specific. And so for the most part, I think we're still probably 10 to 20 years away from a point where we can particularly target what is going on in the microbiome and then give a microbial-based therapy to change that. I think the science is not quite there yet, and the data is not quite there yet as well. Constipation, more common than people admit. Constipation is something that many patients deal with, or interestingly in the clinic, many patients think is a completely normal experience for them to have. Common causes of constipation, opioids are a really big one, and pain medications. Other medications that can slow down the motility of the GI tract are also implicated here. Diet and hydration, so not enough water, not enough fiber, and physical inactivity. And so one of the things I like to point out with this is that all of the things that are good for the gut microbiome and good for preventing disease and good for preventing cancer are also the things that are going to treat constipation and are the foundations of lifestyle medicine that are good for pretty much anyone to practice. So the simple starting points for patients experiencing constipation: increasing fiber gradually. So remember, fiber is like lifting weights for the gut. You want to start by a little bit. You want to add one new fiber food per week, see how you tolerate it, increase with more fiber as you can. And that's to avoid bloating and to avoid discomfort. Drinking more water. So importantly, fiber without water actually makes constipation worse. It just dries everything up and everything gets stuck together. But fiber with water works in conjunction, particularly soluble fiber, which means fiber that dissolves in water. This functions to bring kind of like lubrication and moisture into the bowels, which help with bowel movements. Walking daily, so even a 20-minute walk can help to stimulate gut motility. Going for a walk after meals and moving just in general is going to be really good. And then another one is a footstool on the toilet. So a small footstool to change I should have added a picture of this, to change the angle by which your rectum can open. I don't know how else to say it. Will help to have a bowel movement. The toilet seat and sitting on the toilet seat, actually it causes a kink in the angle where the stool is supposed to come out. And so by raising your feet up, I think there's a brand called a Squatty Potty. It works to help line things up a little bit and ease the bowel movement. What diet is the healthiest diet? If you ask any doctor, they're always going to say the Mediterranean diet is the healthiest diet. Now, why is the Mediterranean diet the healthiest? Because it's the most evidence-backed pattern for gut health and for longevity. So they've done many, many studies on the Mediterranean diet, and it's all been quite good evidence to support using the Mediterranean diet to lower cardiovascular disease risk. It's good for the gut microbiome because of the varied foods, fats, and fibers. It can decrease inflammation. They've shown that certain groups that adhere to the Mediterranean diet have improved cognitive performance, reduced markers of frailty. And the core of the Mediterranean diet is things like olive oil, fish, beans, vegetables, whole grains, nuts, fermented dairy. And so on Pender Island, you already have all of the ingredients that you guys need to be able to sustain these healthy lifestyle choices. I promised we would dive into fiber. I think I've been speaking about fiber as we've gone through the talk. Here are the numbers. So 25 to 30 grams should be your daily target. Most Canadians on average are getting 16 to 18 grams, which is around half. And you could even argue that there are a lot of people getting even less than that. Only 1 in 20 North Americans hit their fiber goal. And so what are the types of fiber? There's soluble fiber, insoluble fiber, resistant starches. So examples of that: oats, beans, vegetables, whole wheat, potatoes, and rice. These are all things that each have their own specific function in your health and in your gut. I don't want you to come away thinking, oh, I need more fiber. I need to dump a whole bunch of Metamucil in my morning coffee and that's going to fix all my problems. The key point here is diversity. The key point is understanding that there are different types of fiber, and the more you can vary your diet, the more you can do a little bit of everything, the healthier overall it's going to be for you. What are some of the best high fiber foods? So lentils is up there. 1 cup of lentils has 15 grams of fiber. Black beans are also up there. 1 cup of black beans has 15 grams of fiber. An avocado has 10 grams, a cup of raspberries, broccoli, oats, an apple with the skin. So the idea here is that all these different sources have a lot of different benefits for you. Things like the skins, unprocessed or unprocessed wheats and things like that that have a little bit more of the fibrous parts to it. The more you can include in what you're eating, the more variety that your gut is seeing and the healthier it'll be overall. Fermented foods. How do fermented foods, what role do they have in the gut microbiome and in the health of our bowels? They're mainly foods that are containing live bacteria. So when you're eating a fermented food, you're taking bacteria and you're adding that directly to your gut. A certain Stanford study had found that after 10 weeks of daily fermented food, the level of inflammation measured in their patient population decreased, and they increased the level of gut diversity as well. So when comparing to fiber alone, fermented foods had a better immediate result. Some examples here are yogurt, kefir, kimchi, sauerkraut, miso. And so 2 to 3 servings of fermented food on a day can make a measurable difference when it comes to your gut diversity and inflammation. The key here, though, is not that the fermented foods are the cornerstone. I think more of this fermented foods as like a symptom treater. So, you know, if you've had antibiotics or you're trying to replenish your gut microbiome, fermented foods are really good. If you had to ask me what's more important, fiber or fermented foods, by and far, the most important thing is fiber. Think of fiber like the soil that allows the rainforest to grow, and fermented food more as some of the birds and the animals running around in the rainforests. If the soil is not fertile, it doesn't matter how many birds or animals you put into the ecosystem, it's not going to thrive and it's not going to be able to survive. So here's what I will pose to you is the 30 plants per week challenge. Now I'll have you know that at our dinner last night, Peter and Lisa served us 36 different plants and vegetables. And so, it is possible to get a huge number of different plants on a daily basis. And the purpose here is understanding that it's diversity, diversity, diversity. Incorporating different plants and different vegetables allow for different bacteria to populate your gut, and for different bacteria to populate your gut, it results in a more diverse community, and a more diverse community is able to solve more problems. Eating the same type of fiber is good because more fiber is better than no fiber, but without the diversity and the different set of bacteria, the problem-solving set of that one set of bacteria is going to be a little bit more limited. So the 30 plants per week is the threshold that has been studied, that has shown for people who are able to get more than 30 plants per week, the diversity of bacteria in their gut increases, and it becomes more robust, and it becomes a healthier gut microbiome. So every variety counts. An apple and a pear is 2 points. If you put garlic, cumin, turmeric in one dish, that's 3 points. And so it's not just eating the plants raw, it's your seasoning, it's adding a little bit of this, a little bit of that. It's eating the rainbow, it's all of these things that are going to be working together. Exercise, sleep, and stress. So I've mentioned this a couple of times. Exercise is important, 150 minutes. Sleep is also important. Interestingly, your gut bacteria have their own circadian rhythm. They are in rhythm with you as well. If you're waking up and eating in the middle of the night, if you're not sleeping and you're staying up, if you're drinking a lot of energy drinks, etc., these things have negative effects on the gut microbiome. If you're got a healthy sleep-wake cycle, healthy circadian rhythm, that's also been shown to have a healthier, more diverse gut microbiome. Stress is another one. Chronic stress makes the gut wall more porous, can contribute to some leaky gut and things like that that we discussed. And so anything that you can do that is stress mediating and stress managing will also benefit your gut. One of the things that I talk to my patients in the GI clinic about very often, patients who suffer with disorders of gut-brain interaction, with IBS and with things like that, is about how important the stress connection is. There's actually a lot of really good data for gut-directed hypnotherapy to reduce stress and to improve gut symptoms. And that is just a very salient example of how when we manage our stress, it does have a very positive effect on what's going on in the gut. So deep breathing, diaphragmatic breathing, this activates the vagus nerve. The vagus nerve is one of the biggest nerves in the body, and it's the nerve that controls all of the gut's functioning. So we've talked about this a little bit, but I'm going to reiterate it one more time. Medications that can harm your gut that you might not be thinking about. Acid blocking pills have been shown to cause some of the things that we talked about, C. diff, vitamin deficiencies, but the data for that is not incredibly robust. And so if you have a condition that has an acid blocking pill indicated, the recommendation is to continue to take the acid blocking pill. If you don't need the acid blocking pill, you don't need to continue to take the acid blocking pill is kind of the main thing here in the spirit of deprescribing medications that aren't indicated. Antibiotics, if you have a cold or if you have something that doesn't necessarily need antibiotics to treat, don't get antibiotics. If you have an infection that is indicating for antibiotics, the benefit of taking antibiotics versus not taking antibiotics greatly outweighs the changes to the microbiome. But we do know that antibiotics do cause a lot of harm to the microbiome. One course of antibiotics can disrupt the microbiome for up to 6 months. Now, the data there is a little bit, it depends. So if you had one course, it could disrupt it for 2 weeks and it could come back. If you had 2 courses back to back, it could disrupt it for 6 months and then come back. If you had multiple courses of heavy-duty antibiotics through the intravenous, your gut microbiome may never get back to where it was. And so it's quite nuanced, and it depends. Opioid pain medications are another one, causing constipation. And then the constipation kind of backs everything up, and that itself can have drastic changes to the gut and to the gut microbiome. Probiotics, a quick plug for this. What's the evidence for probiotics? What are probiotics, and should we all be taking probiotics to have a healthy gut microbiome? So there's good evidence for probiotics in a very select few situations. Number one is antibiotic-associated diarrhea. This is a little bit different than C. diff. This is just getting diarrhea when you have antibiotics. And so probiotics here have shown to decrease the severity of diarrhea. Specific gut infections, for example, for patients who have ulcerative colitis and they get their colon taken out and they have their small bowel used to create a new colon, they can get a disease called pouchitis. There's very good evidence for a certain strain of probiotics to prevent pouchitis from happening. And that's kind of all the evidence we have for probiotics. The rest of the evidence for probiotics is very weak. Probiotics for general gut health. A probiotic usually contains a limited amount of strains. So it may say lactobacillus, or it may say, 10 different bacterial strains for your gut health or something along the lines of that. When we look at the gut microbiome, if you recall, there's hundreds and billions and all of these different strains working together. So when we're introducing large amounts of the same types of bacteria, we're actually decreasing the diversity of our gut. It may help with symptoms for some people, but by and far the best thing you can do for your gut microbiome is going to be eating more fruits, vegetables, fibers, increasing the amounts that you're eating, and doing those things, avoiding the medications. If you find that probiotics are helping you and you go off of them and you get much worse, by all power to you. Please continue taking your probiotics. Do I tell patients to try probiotics if they're interested? Yes, I do. But the evidence is not there. There's not good scientific evidence to say probiotics are making a lasting effect. Chronic conditions, IBS, IBD, the evidence is quite mixed. There's not good evidence to say we should prescribe this type of probiotic for this type of situation. It's very nuanced, and most of the data is quite underwhelming. Weight loss or immune functioning, all of the tried and true things like dieting, exercise, sleeping well, managing stress are going to work tremendously more than probiotics will. And there was one study that looked at what happens to your gut microbiome after antibiotics. And it looked at 3 different groups. It looked at one group where they got antibiotics and then they did nothing. And then they looked at one group where they got antibiotics and then they got a fecal transplant of their own poop pre-antibiotics. And then there was a third group where they got antibiotics and then they got a probiotic afterwards. For the first group, they got antibiotics, they did nothing, their microbiome went down, and then slowly it got back to where it was. The second group, they got antibiotics, and then they got their own poop back from before, and it went right back to where it was. The third group got antibiotics, and then they got probiotics, and now what we saw was their microbiome actually just looked like the probiotic. Rather than it being diverse and this rainforest full of different bacteria, it was the equivalent of like now, the rainforest is just full of rabbits, and there's rabbits everywhere. And there's no space for anything else because the rabbits are eating everything and everything is all over. So I found that was a useful example of how the idea of probiotics can be attractive, but when you look at the science and you look at what your body actually needs and how your body actually works, it doesn't necessarily play out the way you would expect. Okay, what do I want you guys to take away from our talk today? Here's our 8-point gut health prescription. Number 1, 30 plants per week. Should be easy. We could do it 36 plants in, we could do 36 plants just for dinner. You guys can do 36 plants in 1 week, no problem. Number 2, 25 to 35 grams of fiber daily. Remember, fiber is like lifting weights for your gut. Introduce a little bit and slowly progress. Progressive overload. That's the mantra when I was a football player and how you got your bench and your squat up. And now that's the mantra I give people about eating fiber. Progressive overload. Fermented foods daily. This is if you feel that you want to give an extra boost to your gut microbiome. Yogurt, kefir, kimchi, sauerkraut is something you can add to your daily routine. Movement, 150 minutes per week is the minimum. Moderate exercise where you're really working to be out of breath. Get your fit test if you're within the screening range for colonoscopies. If you're outside of the screening range of colonoscopies, ask your doctor. Hey doc, I feel like I'm still pretty fit. Do you think I could still be screened for colon cancer? It's not an unreasonable thing to do. Review your medications. Think about things that you need, think about things that you don't need, and how these things might be affecting your gut and your overall health. Limit processed foods. Reduce processed meats, ultra-processed foods. And if you don't know, cold cuts and processed meats are a group 1 carcinogen. Just as bad as smoking. And then lastly, sleep and stress. Prioritize good sleep, good de-stressing routines, and daily stress reduction. Warning signs to see your doctor: blood in the stool, change in bowel habits, unexplained iron deficiency and anemia, unexplained weight loss, difficulty swallowing, new or worsening abdominal pain that persists. These are all reasons to seek medical attention and things not to just ignore. So what's coming next, the future of the microbiome, etc.? I think that the microbiome-based treatments are a little bit a ways away from where we're at. I think that focusing on the intuitive things that we talked about today is going to give you 90% of the benefits. And advanced therapies, fancy microbiome pills, probiotics and all these things is trying to squeeze out an extra 5 to 10% of benefits when we already have all the tools to make the biggest change right in front of us. So lastly, return the favor. Here on Pender Island, you have what most people don't have. We've been enamored by how beautiful it is here and all of the luscious land you have and everything, and it's truly a paradise. And so take that to heart and really embrace everything that's around you. Every meal is a conversation. Not only should it be a social thing and a conversation between you and your peers, but every meal is a conversation within your own body, between you and your bacteria. Every walk waters the garden. Every time you spend outside moving and in nature, it has more of an effect than you know. It's affecting you on the outside in your exercise, but it's also affecting you on the inside, and your microbiome is adapting and all these things are changing. And then lastly, progress it's progress, not perfection. So slowly changing and making healthy habits is way better than being perfect for 3 days and then binging for the rest of the days and then going back and forth. It's consistency truly and not kind of being a perfectionist. And that's it. That's our talk.
Some questions for Estello? Maybe we could have the lights.
Yes, yeah. Yes.
You mentioned lentil breakfast regulates the blood sugar well for the rest of the day. I think that's because it's high in fiber, and black beans would have the same result.
Correct, yeah.
So the idea is to have a high fiber breakfast.
Exactly, yeah. And that'll hold true for whatever type of fiber it is. But moving away from things like sugary cereal, breads, things like that. Yeah. No cocoa puffs.
Question here and then.
Yeah.
You didn't mention anything about fasting, intermittent fasting, and whether has there never been research on that, or does it have no benefit?
Yeah, so there are benefits for intermittent fasting. The benefits for intermittent fasting are mainly around calorie restriction. And so calorie restriction then turns into help with weight loss. Intermittent fasting has also been shown to increase muscle mass relative to fat mass. And then there's also good data to show that intermittent fasting increases things like autophagy, or the cell's ability to look at which cells need to be gotten rid of and which cells need to kind of be refurbished in our bodies. But the data for intermittent fasting and the microbiome is not really there. It's more about what we're putting in and out, so to speak. But yeah, could give a whole talk on that. It does have its own health benefits, but not specifically when it comes to the gut microbiome or the health of the gut.
Any relationship to leaky gut? And
Did everybody hear the question?
Not that I'm aware of. I think that there's some data to suggest it's good for inflammation, but I'm not as up to date with that to give you a reliable answer.
Ryan?
I had an observation and then a question.
Okay.
First off,
Talk loud.
good job, your mom.
Yeah.
I noticed on the board there, it said something, or on the screen, it said something about cold potatoes and cold rice. Why is that?
Yeah, I think because when it's more heated up, wait, I'm trying to think of the slide.
Cold.
Yeah, I saw that.
It was the different types of fibers.
Yeah, I think it might have to do with the starch, that when you heat up the starch, it's less absorbed in your body.
But you heat it up, you cook it, and then
it
cool?
Yeah.
Heat it again, and that's fine. The second time is what I've read, because I've been doing that. So you cook your potatoes, you cool them, and then you have them the next day. You can heat them again, but it does something pretty significant.
When you let it cool, yeah.
That's curious.
Heather.
Thank you for answering that.
Heather.
Hi. I have two questions. One is you mentioned low-level chronic inflammation, if you could share some of those symptoms. And then the second question is about pesticides and how that might impact our microbiome.
Yeah. So low level of chronic inflammation, I think is going to manifest itself very differently in very different people. One example that I can use is that when we are following people for inflammatory bowel disease, we'll measure levels of inflammation in their bowels, and we'll measure levels of inflammation in their blood, and they don't always correlate. So sometimes people may have ongoing levels of inflammation in their bowels, and they'll be asymptomatic, but it'll be a key that we need to change their therapy because we're targeting the specific levels of inflammation. Other people may have low levels of inflammation and be incredibly symptomatic. Brain fog, fatigue, muscle aches, myalgias, you name it. The symptoms of inflammation can be quite varied. So I don't think that I could say, okay, this is what it looks like. It's more so a habit of how to change your habits and your practices, and then each individual will probably notice some differences. And then, sorry, what was your second question? Pesticides. Yeah, pesticides, microplastics, a lot of these things that are we're starting to understand are in our food supplies, and we're starting to understand have an impact in our bodies. It's not well studied. So we know that pesticides, for example, in places like India, where pesticides and antibiotics are used quite a lot in the agriculture, in the farming industry, the rates of multi-drug resistant bacteria that we see in the gut microbiomes of patients are way higher. So we know that it does make its way into the body. How does that manifest itself? What are the long-term consequences? How do we navigate that in the bigger scheme of things is not something that's well understood. But I would say, for myself and our family and the things like that, we definitely try to avoid pesticides and to eat organic where possible, because you really don't know what's going to happen, and I suspect with more data and more years of observation, we'll probably be able to clearly say, oh, it causes X, Y, and Z, like we have about processed meats and things like that.
Are there studies currently that being done on that? Or?
I think so. Yeah, I think it's definitely a topic of discussion, and you just need to go on the internet, and there's plenty of information there. But the high randomized controlled trials and things like that haven't really been done, and nutrition research in general is notoriously hard to do, but I would venture it's going to be answered in the coming years for sure. Yeah.
Lisa, you had a question?
Oh, I had a question. It's the hot cold thing about miso, because you had miso in lentils, but it was hot, and it said on the thing that somehow you put them in later, so I'm really concerned now.
Ah, yes. The soup was delicious. The soup was delicious.
There was no miso in it, was there?
Was. I put two big
Yeah.
pots of miso in there.
So specifically for miso, I think when they make miso soup,
Yeah,
they,
it's hot.
yeah, but they don't boil the soup. They put the miso in after. Yeah. And it's because it kills the bacteria. And so miso being a fermented food, the benefit is from eating the live bacteria, so to speak.
So you'd have to know what temperature it kills it.
Yeah, non-boiling. But it still adds flavor.
Yeah.
And the flavor was delicious.
Okay, we'll do 2 more questions, Carol and Bob, because I have to get them to the ferry. And Janelle.
I have a question about fecal transplants. This goes back because my son was overtreated with antibiotics from a bad infection, got C. difficile, ended up with ulcerative colitis because of that, cascading, ended up with E. coli.
Yeah.
And at the time, it was not legal to have a fecal transplant, and this would have been 18 years ago.
Yep.
Something like that. He was very young. When did it become legal?
Last 5, so legal and FDA approved are probably two different things. I don't know when it became legal. People have been doing it for a long time. They came out with an FDA approved therapy in 2022, 2021, meaning that the FDA said this is a formalized treatment, and it's made its way into the C. diff guidelines and things like that, where it says treat C. diff, first line, second line, refractory C. diff, treat with a fecal transplant. And so that's very well established. It's a very indicated position for it right now. And some of my mentors who I've done fecal transplant research with, they've said that, 18, 20 years ago, when they were trying to see if this would work, they would show up to people's houses with a suitcase. And you can guess what's in the suitcase? It was a blender and a bunch of other stuff, and they would do these things. And so, yeah, it was quite a challenging thing to get approved. So yeah, I'm sorry to hear about your son.
It was something they looked into, and it was available in the States, but
Yeah.
it wasn't available in Canada. And it was still the grinding.
Yeah.
But at that point, you had the ulcerative colitis, and they were using that to treat ulcerative colitis.
Yeah, the data for fecal transplant in IBD is mixed. Yeah, sometimes it works, sometimes it doesn't.
Bob?
Peter, just very quickly, really a good presentation, a lot of details. My chief cook couldn't come today, and so I want to review some of this stuff with her. It'll be on the website soon.
Yeah, so
Yeah.
all the talks are on the website. Rutger puts them up there pretty fast, right?
Yeah.
So
Oh.
no pressure.
And
Anybody can go and get the details.
And I should add that in the next couple weeks, I have a newsletter coming out, and the first newsletter is going to be a revisit of our talk today, and I'm hoping to maybe include a recipe and some stories, and future episodes of the newsletter will kind of just touch on different GI fitness related topics that I'm interested in. So I think Peter might be able to share.
Pender could be the beta site for your.
Exactly, yeah. So you can stay tuned for that as well, and we'll have all that information over there.
Speaking of fitness, so after that 36 vegetable meal, Janelle, his fiancée, and Estello got up this morning, went to Gallon Point, and ran back all the way to Slow Coast. And that wasn't enough, so they kept running Privateers Road and back again. So it works,
Yeah.